guys, today I wanted to talk about some tips for dealing with nausea in pregnancy. Whether you have hyperemesis, gravidarum, which is basically excessive vomiting, emitting during pregnancy, that's the gravidarum part, or maybe some morning sickness that you're just trying to get through the day, be able to work or take care of your kids. So I'm going to talk a little bit about what worked for me in 2 pregnancies that I've had where I was really sick. My first tip for you is lemons. Cut them open, inhale their citrusy goodness. I always enjoyed the smell of lemons, but when I was pregnant it was one of the few smells that smelled really delicious, like calming and refreshing and pure. I use this at school where I was teaching. I keep them in a little side drawer and then make a fresh cut in between classes or when I needed to rejuvenate but I couldn't go lie down or go have a snack. I also used it in the car when I had to go get IV fluids because I just could not stop throwing up, and I didn't throw up in the car. Of course, lemons won't prevent nausea, otherwise morning sickness would have an easy fix, but they can really help in a pinch. Just don't leave them in your desk drawer because they will get really moldy and nasty, and no one needs that, especially when they're pregnant. My next tip is another kind of quick fix, and that was to suck on ginger. I use the ginger chews by Chimes, I think. And I especially like just the original ginger flavor and also the mango and the orange. There are a couple other flavors like peanut butter with the ginger or peppermint, which just really disgusted me while I was pregnant. But if that's your cup of tea, you could try those. I just got the mix pack on Amazon, but I've seen them in some stores lately like Whole Foods. So those are worth a try. I can put a link below to what I got if you want to check it out. On the note of ginger, I tried ginger tea, but I couldn't keep that down for some reason. But that's another option for you if you're a tea drinker. There's also ginger gum, but for some reason it just seemed unappetizing. I just kind of like to hold the ginger in my mouth rather than chew it. But if you're a gum chewer, you could try that. And the thing with the ginger was it would give me a little extra time. Like if I had to put my older daughter to bed, or if we were waiting at a restaurant to eat, or if I had to teach one more class before lunch, just kind of having a little something would time me over. It's not a long-term fix. If you don't eventually refuel and relax, you're gonna get really sick, and especially if you have severe morning sickness, or at least this is what happened with me. If I didn't eat when I had that window open, I would get sick and then I couldn't eat. I would just keep getting sick, and it was really hard to break that cycle. So the best thing to do, which leads me into my third tip, is to avoid getting really hungry. Obviously no one sets out to get really hungry, and it's a lot easier said than done, but when you're pregnant, you need to eat, and that's your priority. It doesn't matter if you're going to be late for work, if you're going to miss a wedding, like, you need to eat. And you have permission to treat yourself like a little kid, like a toddler. You're not going to make them skip meals. You're going to make sure they have food, and you're going to make sure they have rest, because if they don't, they can make your life hell. Well, the same thing for you. Your body needs food, and you need to take care of yourself as much as you would take care of your child, because you are doing that. Another tip related to food is to try an evening protein snack. I didn't actually do this with my pregnancies because I didn't know it would help, but I was definitely the type where I'd wake up in the wee hours of the morning already sick, tossing and turning, and I would just throw up, saliva or bile or whatever was down there, and I didn't know what to do about it. And I wasn't going to set an alarm at 2:30 in the morning and then go make a snack and brush my teeth and use the bathroom and get back into bed. That's not realistic. But you could try a couple tablespoons of peanut butter or almond butter, or maybe some meat, though you're not really supposed to do deli meat during pregnancy, but any other type, before you go to bed, and see if that can keep your blood sugar a little more stable while you're sleeping, because your fasting blood sugar, which you may have had taken in a blood test, if it gets too low, that can produce those symptoms of feeling really, really hungry all of a sudden. You need to eat then, and if you don't, you feel nauseous, and maybe you get the food that you want and you can take a few bites, and then that makes you feel sick, and so you just go up and down, and it feels bad, and it's not good for you. So a nighttime protein snack, or something that's filling, not something sugary that'll just kind of spike your blood sugar and leave you hanging, would be something to try, and I would definitely do that if I got pregnant again. And one more thing along the lines of food, a lot of people like to keep a snack right on their nightstand, and I think that helps. It wasn't a huge helper for me, but maybe a granola bar or some crackers so you could eat before you even got your day started. Or if you happen to wake up, you could stuff a little food in your mouth to try to carry you through until the next morning. I was always worried about putting stuff on my teeth that I wasn't going to be able to wash off. Just swish a little water around and, make an exception because you're pregnant and you need special care, especially if you're really sick. My next tip is to relax, especially when you're feeling really nauseated, or if you're feeling nauseated, for the 10th time that day, and the anxiety kicks in and you don't want to throw up and nothing seems appetizing to eat. If you're at home, if you could take a warm bath, if you have somebody who'd give you a little massage, or even if you can call somebody up who'd lend an ear and just be really sympathetic to how you're feeling, that won't get rid of your symptoms, but it'll bring you down to a place where you can make a decision. Maybe say, I'm just going to go to bed, I'm exhausted, and I think I can do that. Or I'm just going to eat some nuts because that's all I have in, and that's good enough. And when you're all worked up, it's really hard to think clearly. And, you just feel the pain more. It's a nasty cycle. That anxiety feeds the sort of sickness that you're feeling. My husband would always freak out when I told him I was feeling bad because he was worried for me, but that always made me feel like a burden and feel even worse. So maybe educate your partner or whomever you're living with as to what you need, when you're sick. I always needed someone to help me think of something that I could eat because I knew I needed to eat, but I was sort of crazed or pregnancy brain that I couldn't think of anything that I wanted. My next tip goes back to the food, and that's drink your meals rather than eat them. I find it a lot easier to get down a nice cold smoothie or a protein shake than a full meal with all its textures and smells that can really churn your stomach in the beginning or any time of your pregnancy. I think it being cold sort of overrides, the scent and the taste, so you can get it down, and the texture is sort of smooth and creamy, like it's like baby food. And so you need a little TLC when you're not feeling well, and that even if you have to make 3 smoothies a day, that's fine. If they stay down, and you can add nut butters or coconut manna to them to make them more filling, and you can even add oatmeal or avocado or other things you might not ordinarily put in a fruit or green smoothie to help fill you up and to replace meals if you need that. I wanted to mention a couple other things that I tried that weren't huge helps for me, but they might be a help for you, or you might have had a similar experience to me. I wore those motion sickness or seasickness bands on my wrists. I don't know if mine weren't tight enough, but they didn't make me feel a whole lot better. I will say that wearing them, at least at the beginning, I would feel nauseated but not actually throw up, because as soon as I took them off, I would throw up, and that gave me some relief. They just didn't make me feel a whole lot better. The same with the acupressure point in your wrist. Although, if I were to get pregnant again, I would try acupuncture. I've heard some insurances will even cover it if you have hyperemesis, and I think someone who really knows what they're doing is probably better than a bracelet from Walgreens or me pushing maybe in the incorrect space in my wrist. So that's worth a try if you're into that. One tip I wanted to mention, which will not unfortunately prevent nausea, but can be kind of reassuring, is to make sure you have plastic grocery bags stashed in your car and in your purse. I know I was driving on the highway and I just had to throw up and I couldn't pull over, and so I grabbed from the back seat pocket a bag and tied it up and threw it on the passenger seat. And also just being out, especially if you're out with other people or in your shopping mall, you can't immediately leave. Knowing that if you're going to get sick, you have somewhere to get sick and it'll be okay, can take a little pressure off. And lastly, I want to just say, if you're going through sickness right now, I get where you're coming from, and I'm really, really sorry that you're feeling bad. And I can tell you that it might be a while, but you'll get through it, and it'll get better, and you'll feel like your old self again. I remember being maybe 9 weeks along and thinking, oh my God, 31 more weeks? That was inconceivable to me that I would have to feel that bad for so long. And I went back and forth. I didn't feel that bad all the time, but now, now that I'm not experiencing it, I can see it with more perspective, and time stops for no one, and it won't stop for you. And I think just knowing that there's someone else out there who's been through it, who can empathize with you, can make you feel a little bit better. So leave me a comment if you need some encouragement. I hope that you feel better soon. And if you have any questions for me or requests for more tips or meals that I ate that I enjoyed while I was pregnant, let me know down below. And I'll see you next time.